Hello everybody, welcome back to my channel. My name is Pinky. I'm a clinical pharmacist practitioner. Today I'm making this video for the general public to identify if there's any underlying medical condition going on in their feet. And in order to do that, I'm going to discuss about how to look, sense and feel the feet. So let us discuss about how we are going to inspect the feet. In order to inspect the feet, it is very important to look for any kind of scars, any kind of wasting of muscles, like as if you're losing muscles in your feet. If there is any kind of involuntary movements movement that is happening on its own, any kind of tremors, and another one is the muscles twitch, whether the muscles twitch in the feet on its own, if there is any contraction, relaxation, and also you need to look at the color of the skin of the feet. It's very important to look at the color. This is because if it is too red, if there is as if there are spider veins in the skin, you need to look for that. You need to look for any kind of paleness in the skin. Callus corn, I made a video on calluses, so you can have a look. And thickening, if the skin is thickened in the feet, obviously if there's any kind of ulcerations, blisters, or if there is any kind of evidence of trauma. And in between toes, it's very important to check in between toes. This is because to check for infection. And you also need to look for inflammation of skin around the nails. If sometimes around the nails the skin gets infected because of bacterial or viral infection, and if there is any kind of cracks, if the feet sweats a lot, if the skin is dry, if there is any kind of wounds, if the skin is blue in the feet, if there is any kind of hair loss, if there is any kind of hair loss, there can be vascular peripheral disease. And just feel the feet and see if you can sense the pulses in the feet. It's very important. Feel the temperature with the back of your hand and see what's the temperature. Is it very warm to touch? And obviously sometimes as a practitioner, I do check the footwear of the patient as well, whether it is uneven wear, or if just to identify if I need to advise patient anything on their health. So this is all about how to look the feet, what things to look for. So in medical term we say inspect the feet, but basically what you're gonna do, you're gonna look at the feet. Okay, now let's talk about in details how we are going to feel the feet. Okay, so in order to feel the feet, you feel the skin for any kind of warmth, coldness, skin temperature, if the feet is tender anywhere. And then also check for the foot pulse. So take 2 fingers, put it right here and see if you can feel the pulse. Yes, I can feel the pulse. Then take these 2 fingers and put it right here and see if you can feel the pulse. Yes, I can feel the pulse. So this is how you're gonna feel the feet. Okay, now I'm going to discuss about how to feel the sensation in the feet. In order to do that, what I did was that I took my comb and I'm gonna use the handle of the comb to see if I got sensation in my feet. Okay, I'm gonna take the handle of my comb and I'm gonna touch in 6 places, poke in 6 places. 1, 2, yes, I can feel it. 3, 4, 5, 6. So yes, I can feel the poking of the handle of the comb, and yes, I can sense it. Okay, it is very important to check the sensation in the feet. Your feet is at low risk if you can feel the sensation, the pulse, and everything looks normal. Your feet is at increased risk if you can't feel the pulse and there are other risk factors involved, such as like poor footwear, social circumstances, poor diabetes control. Then you need to be referred to a clinician. Your feet is at high risk if you can't feel the pulse, if there is any kind of foot deformity or skin changes, thickening, redness, previous ulcers, or if there is any kind of surgery done in your feet. And when you need to be referred on an emergency basis to a clinician or a hospital, if there is new ulceration, swelling, spreading of infection, discoloration. Thanks for watching. That's all about how to feel and sense the feet. Hopefully you will be able to do that at home. Please do like, share and subscribe my channel. Follow my Facebook page, Clinical Pharmacist Practitioner Pinky.